our staff is overwhelmed.
The sheer volume has made finding a bed for our patients a daily logistical puzzle.
So a new patient every 2 minutes. It's still early in RSV and flu season, so it is no surprise our local hospitals are overwhelmed right now trying to take care of hundreds of sick kids.
Tiffany Liu is in Fort Worth live. The Cook Children's in this hospital has some important advice for parents right now who are just trying to get their kids well.
Yeah, Mark, Karen, this is an urgent message to family. Cook Children's is extremely overwhelmed right now, not only in their ER, but in their urgent care centers as well. So right now they are operating under disaster code, and that means doctors and nurses are picking up extra shifts to make sure they can take care of the children that are coming through the hospital. The problem is, like you mentioned, right now it's only the beginning of cold and flu season. They are expecting it to get worse. Now, this week in a 24-hour period, Cook Children's emergency room saw 603 patients. Their urgent care center saw 760 in that same time frame. Now, doctors and nurses tell me they've never had to turn patients away before. This is the first time they've had to transport patients to hospitals out of state for capacity reasons. Right now, they're seeing all sorts of illnesses, but RSV is one of the main concerns. Cook Children's saw 263 RSV cases this week. 28 out of 38 ICU beds were filled with patients with RSV. Now, it's not only Cook Children's. The DFW Hospital Council says 95% of pediatric beds in this area are full. It means families are waiting up to 10 hours sometimes in the ER for care.
As a nurse that has been here for 35 years, I've never had to turn anyone away. And that's the worst thing that, in my mind, that I can do. I want you to come to Cook Children's because I think this is the best place for your child. And when I can't serve that child and that population, it breaks my heart.
Now, that nurse tells me that if your kid is sick, make sure you call your pediatrician first. Only come to the hospital and the ER if it is absolutely necessary. And if your child isn't feeling well, make sure you keep them home from school so they don't get the other kids sick as well. Now, Mark, I know you've had a few sick kiddos at home. You've been to Cook Children's. You've seen it firsthand how busy it is this week, right?
Yeah, that's right. We were at the urgent care center. We've made a couple of trips there actually over the course of this week. And we went the other evening, and it was a 4-hour wait to get in and see a doctor. It was 1 hour to even see the intake nurse as well. So we ended up just going home. But I think there's great advice about making sure you make the phone call to your pediatrician if possible to make sure that's where you need to be.
Yeah, absolutely. And that's one thing that they want people to know is that, you know, you bring your child in, and of course that is your primary concern, but sometimes when children come in on the ambulances, they have a more severe illness that needs to be looked at first, and so you may need to wait longer if you're bringing your kid in. So that's why they say call the pediatrician at first, and maybe you can take care of it at home with Tylenol or Motrin or something like that. So get that advice first before you come to the ER. Let's send it back to you guys.
Yeah, thanks, Tiffany. Here's hoping they can get some of those kids healthy and well as soon as possible.
Well, this